I've seen what diabetes does to people. I see the complications, and it's really a tragedy that could be prevented in most cases. And that's what most people don't understand, is that for the most part it is preventable.
5 years ago, my sister died from complications of diabetes in this hospital right here. And after her death, I thought, what could I do to make an impact in Wayne County and help in the cause for diabetes? Out of the adult population, 40% are obese in Wayne County, 34% are pre-diabetic, and about 15% are diabetic. The pre-diabetes is what we're hoping to be able to stop.
The UNC Health Wayne Diabetes HealthCheck program is a mobile diabetes prevention program that we have here at the hospital. It is free to anyone who lives in Wayne County. We go to places in the community where people congregate, so it could be a church, it might be a place of business, a civic group, out in the rural parts of our county and also within the city limits. And we offer diabetes screening for our community members. And if they are deemed at risk, then we will perform an A1C hemoglobin check, and we will advise them on what to do after that, if they need to go see a provider or if they need to come to our classes.
Screening and education for diabetes health check are really two sides of the same coin. There's such a knowledge deficit in the population on how do you eat healthy? How do you exercise? It's intimidating to people. So we want to simplify that so that it's applicable to their life, to their culture, what their lifestyle should be. We found that a lot of the people that we go and see in the community events that we hold are people who could afford to go to a healthcare provider to be screened, but preventative care doesn't really take a priority. But the problem is with type 2 diabetes, you could be having a worsening issue with that and not have those symptoms until you do. And then it may be too late to prevent because there's complications involved.
The staff at the UNC Health Wayne were just extremely helpful. They were there for you. They answered the questions, and they were kind, when they told me that I was probably carrying a few more pounds than I needed to. So I began the journey of educating myself about food. To my surprise, in 6 months, I was able to lose 55 pounds. And when UNC Health came around the second time, which is like 5 months later, my blood levels had dropped 3 points. And so I was really happy about that.
Diabetes runs in my family, and you're concerned about it, and you think about it, and you think, well, that's just something you could take a shot for or a pill for. But to think that you could do it by changing your diet, and with the encouragement of Fred and helping me, I feel so much more better in knowing, the whole foods that we're eating are so much better for me than take a pill to put a Band-Aid on something.
Diabetes prevention program through UNC Wayne is so important to everyone, really, but very important to low-income families. Many of these people do not have health care. They don't have transportation to get to the doctor. And also, a lot of times there's a fear about going to the doctor. And so having this program come right to our front door is so vital. It's really, not a doctor office type of environment. They're right in a building that they're used to coming to have fun. We have a lot of events in the buildings that we do these screenings in. So it makes them feel comfortable, and I think that it's really going to greatly impact our community.
The Diabetes Health Check program is funded through several different sources. We have private donors in our community so that we're able to keep it free for Wayne County. We write grants. The hospital is very supportive of the program, and local businesses that see the need, they want to take care of their employees, and so they're happy to support us.
This is a significant opportunity in this program of providing these health checks to ensure that all patients have the optimal outcome that they can possibly have based upon their current condition. And if there's anything that we can do to help them along that journey, this program helps us to provide that pathway. The program is relatively new, but we've already seen what I would say is significant promise in the early evidence results from the program.
We've had such a success with this program in the first 6 months of it. I can't wait to see what we're able to do in the next 16 years of this program. When you hear the testimonials and you see the people that are coming to your screenings and you're able to celebrate with them that their A1C was lower, that they are not in the pre-diabetes range anymore, and you get to celebrate that with them, that's what makes this program phenomenal, in my opinion. There's just something magical about being a part of that.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.